Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited about my guest today. My guest today is my friend Dr. Jolene Brighten. Dr. Brighten is a functional medicine naturopathic medical doctor and the founder of Rubus Health, a women's medicine clinic that specializes in women's hormones. She is recognized as a leading expert in post-birth control syndrome, and she is back on the show to tell us about her latest book, Beyond the Pill, a 30-day plan to support women on birth control, help them transition off of it, and eliminating the symptoms of post-birth control syndrome. She's a speaker, women's health advocate, and a medical advisor for one of the first data-driven apps to offer women personalized birth control recommendations. Also, did you know that hypothyroidism is still the most common and the most underdiagnosed autoimmune disease? Thyroid conditions continue to impact tens of millions worldwide. And today I'm announcing that I was invited as a guest on the Thyroid Reset Summit. Join us to reset back to healthy. Don't miss the Thyroid Reset Summit from March 4th through the 10th. It's free and it's online. So if you want to join this Thyroid Summit, please click on the link on my bio. I hope you enjoyed the show. Hello everyone, super excited to have my super friend, Dr. Jolene Brighten with me again. You know, our last podcast back in November was so amazing and there was such interest in the topic that we decided to bring her back. Dr. Brighten, how are you?
I am great. I also love, no one's ever called me a super friend right now. So I'm going to just bang that. That's an awesome compliment. I think that's isn't there some superhero gang and they're super friends?
Yeah,
I'm going to have to go Google that now.
Yeah.
And super friends.
We're making the League of Extraordinary Naturopaths or something.
Yeah, I like it. That's hilarious.
And then we have other friends that are not naturopaths like Steph Gaudreau that, she gets a pass, but she's also a super friend.
Totally. No, she is a super friend. Actually, as you say that, I'm like, oh, snap, I owe her a text. I'm not being a super friend right now. Steph, you're going to hear this. I'm sorry.
So, tons of interest because we opened Pandora's box last time you were on the show about the post-birth control syndrome, and we want to, we touched on it and we talked about it and we raised awareness. But let's dig a little bit deeper on this show, okay? So for anyone that doesn't know who you are, what's your hero story?
Oh, yeah. So we're all laughing away. And now it's oh, yeah, what am I up to? So, I explained a bit about this in the last podcast about being a really sick kid, leveraging food as medicine after, doctors dismissing me. I mean, for 10 years, I struggled with chronic gastritis starting at 7 years old. Doctors started to dig when they couldn't find answers. The conclusion was it was in my head until they discovered H. pylori. And then that was oh, H. pylori. So it had already been discovered. Then it finally made its way into medicine. And then someone thought to test me. And lo and behold, after telling this girl it was in her head and she was asking for attention and she had an eating disorder, that it turns out that no, in fact, there was something going on, which I think is an interesting part of my story because it's so much about my work now. There's this condition, post-birth control syndrome. There are plenty of people lining up trying to say this isn't real. I think for every one doctor, there's about 1,000 to 2,000 women saying, yes, it is real. But the same is true with birth control side effects where women are dismissed. For example, mood is one where they, doctors and scientists say, well, there's no study to show causation. Therefore, hormonal birth control has no impact on mood. And we'll talk more about that because it's just any woman who's ever been on hormonal birth control or has had a friend on hormonal birth control is going to be shaking her head right now. Yeah, what is that business about? So, so my background, first degree in chemistry, nutritional biochemistry is my next degree along with clinical nutrition track. So very much have always walked this food as medicine. And I don't know if we talked about this before. So as being a sick kid, I had a fascination with health and I actually was studying herbs and things like that when I was a kid and being whoa, I remember we had a manzanita bush outside of our house when I was growing up. And then I read oh, manzanita berries, you can can crush them up and use them for flatulence. And one of my best friends, her mom was a pharmacist that was super cool to grow up with a pharmacist around you because you could talk about those things. So I was going to get I was getting my master's. I was going to get my PhD in nutrition and be a research scientist. And then I found naturopathic medicine. And at the time, I was working my way through college. I was a group fitness instructor, but I was also a meditation instructor and yoga instructor. And I was doing nutrition consulting. And when I found the tenets of naturopathic medicine, I was like, hold up. I'm pretty sure that's what I did in the last life, because I was like, this is already how I practice. Like, this is already how I'm working with clients now, like what I talk to them about. And like, you mean I could be a doctor and do this? And so that's what took me to naturopathic medicine, and super grateful that hormonal birth control is an option, because the decade I did on the pill was a tool that I used to be able to get into medical school as a first generation college student. I mean, we joke, in my family, we're like, my mom's side is Hispanic, and they're just like, look, you look at a Latina and she gets pregnant. Like, that's the reality. And I was the first person, to make it before 20 without having a baby. Like, that's like, to some people, they're like, yeah, of course. Like, no, that was huge in my family. They actually thought I was infertile by the time I hit my 30s. They were like, so she is broken. Something's wrong with her. But it was because I was using the pill. However, it was when I was in naturopathic medical school that I came to understand that I was only fertile one day out of the month. And that was my first year. So I was like, I'm getting off this business. And I think this is an important part of the story to understand that, like, I have this extensive science background, but not until I arrived to medical school to learn how a woman gets pregnant and like how to help her get pregnant do I actually learn how my body works. Like, that's not okay. So I developed post-birth control syndrome, as we'll chat about what that is. And thankfully, I had this food as medicine background, understood herbs. I was in a great curriculum to be able to work with the body naturally. And although, the conventional doc I went and saw was like, yeah, you probably have PCOS. I mean, that was wrong. It was so obviously wrong. It was something that I was able to reverse. And when I came to understand, when I started my clinical practice, after thinking I was a freak and the only one, I was like, oh my God, something's wrong with me. Is that the majority, if not all, of women struggle to come off of hormonal birth control. And that when I started to get into the research and understand, like, oh my God, what was I doing to my body for 10 years? And I felt betrayed and shocked, and also like I did a really, really bad thing. So if you hear this and you're like, oh my God, I'm like feeling shame, don't feel shamed. I walked through that for you. Okay. You don't got to do that, because the reality is if you're on hormonal birth control right now, there's so much that you can do to heal your body. And in fact, in Beyond the Pill, I've documented protocols from my clinical practice to show women exactly how to do that. And because of my experience of being a sick kid for a decade, having nobody really listen to me, after a period of time when things were exhausted, I decided, like, the only way we change women's medicine is to put it in their hands. Like, the average research study, it comes out, and if your doctor happens to read it or go to a CME where they teach it, it's like 17 years before they're practicing it. And like, man, at my age, 17 years, I'm in menopause. Like, I ain't got time for that. And so that's why I'm like, you know what? I'm going to take all this business, put it in a book and package it up and send it out to women.
And that's if they decide to spend money on women's health.
Yeah. Well, that's the other thing that not a lot of people know, that like we just started studying women like yesterday.
Yeah.
And that this is the thing that I know you and I have chatted about before, but like, on one hand, now, like you and I, we have good friends who are in conventional medicine. So please don't misunderstand me that I'm dissing them, but there's this like mentality that just doesn't make sense, which goes that whatever you recommend must be evidence-based. It must be evidence-based medicine, and never say anything that isn't evidence-based medicine. However, there's plenty of things that they say that they have no evidence to support. It's just dogma. So for instance, they changed the formulation of hormonal birth control. They lowered the amount of hormones compared to the first iteration. And so based on that, they decided, let's start telling women, because it has lower hormones, therefore it has a lower risk of breast cancer or other cancers. And then finally a study came out, and the study straight up called them out and was like, you've been saying this and you were wrong. Like, you should have never been saying that, because there was no studies, no trials, and no evidence to say that. And yet there's still doctors out there saying that. And you'll see it, like, do a Google search. You'll see it in publications, like very notable publications, where these experts are coming out and saying, oh, well, there's a lower risk. And then when they get contradicted, this is always what I love, is that when it's like, well, actually there was this study that said otherwise. Oh, well, it's mild, don't worry about it. Like, well, wait, what just happened there?
It's it's this effect of anything that goes against what was taught in residency, has to be proven beyond the shadow of the doubt. But everything that you have been doing for a while, it's okay because we have used it clinically. But I want to jump back, and I want to talk about exactly what you said. How it's not like we're going to throw our hands up in the air and say, "Yeah, I can't see you because you've been on birth control for 2 years."
No.
It's the opposite. It's like, no, we can help you. But for all the young professionals out there, for me, maybe girls in college or high school that are interested, because I was interested in health at a very young age, and maybe we do have some listeners that are listening that are not thinking, what am I gonna do, because I want to have a healthy sexual life, but I don't want to get pregnant. What would you tell your younger self? How would you go about trying to manage your professional career in pregnancy and sexual health, like before you started school?
So people have asked me a lot of times, like, okay, so knowing everything would you have never done hormonal birth control? And I'm like, I don't think I could say that. Like, that's a nice idea that we all want to, like, look back with what we know now and be like, yeah, that's what I would have done. But I would have done it differently, in terms of knowing that it was depleting nutrients. When I started that pill at 17, I would have not been driving through the fast food window. Like, I would have been eating differently. I would have, definitely been taking a multivitamin or prenatal. Coming from, with my early nutrition training, it was really more conventionally minded. Although I'm so grateful for that training, because we learned to interpret labs. Like, people are like, how do you interpret labs the way you do? I'm like, well, I've been doing it for like a really, really long time. And interpreting it through the lens of food first. Like, we're seeing this abnormal lab marker. And that was really, I mean, we actually got trained in like more functional labs, like, in terms of like, oh, something's coming down the pipeline. And so this is the food to intervene with. So it's stuff like that I would have done things differently. Now, when it comes to birth control, this is a very individualized decision. You'll read in Beyond the Pill, chapter 13 gives you all the non-hormonal rundowns. I didn't go as much into the gels that exist. There are gels that you can place. But, in terms of copper IUD, barrier methods, fertility awareness methods, those are all options. And then for some women, the pill isn't going to be the answer for her. Like, that won't work for her, but she will try the patch or the NuvaRing or go a different route. I am not a fan. And this is my business. Okay, you guys. So, like, understand this, that, like, if, you're my patient, I will support you in your decision. But I'm not a fan of putting anything in the body that you can't get out. So, like, the implant and the depot shot. I remember when the depot shot was first presented to me as an option, I was like, no way. You mean you put that in me and then I gotta wait and, like, it's gotta get out? Like, what if it has a bad reaction? But so I'm just not a fan. IUDs is something that's, like, actually really easy to remove. So if women are listening to that, and there's a lot of iterations on IUDs now, in terms of, like, the Mirena has the highest dose, but now we have all these other forms that have much lower dose of progestin. But the biggest thing that I would say is track your symptoms now, get your baseline labs. It is such a silly thing when doctors say, I'm not going to run labs, you don't have symptoms. No, that's exactly when you run labs. When you don't have symptoms, so you're normal. Like, oh, I was feeling awesome, run those labs. Like, know where your baseline is. And then, whatever contraceptive you choose, barrier methods aside, by the way, if you're not in a monogamous relationship where, you guys are getting tested, then you got to have barrier methods anyway. You need to
Regardless.
be using a condom. Yeah. And yeah, you'd be surprised how many, younger women I have come in and they're like, well, I'm on the pill. And I'm like, well, did your doctor talk to you about condoms? And they're like, ew, everybody says, ew, condoms. I'm like, yeah, nobody loves condoms, but like, nobody loves chlamydia either. So there's that, there's that really important thing. And for women, these sexually transmitted infections can be silent. They can, and then they can lead to like infertility later because they're left untreated. So that's a big deal, you guys. But with that, track your data, get your labs, use your contraceptive of your choice, and then, make sure you're supporting yourself. And in Beyond the Pill, I teach you, like, if you're going to do the pill, the patch, the ring, the IUD, like any of these hormones, here's what to look out for. Here's what your doctor should monitor. Here's big no-nos. It's like, it's time to ditch that and get off of that. Or, what do you need to do to stay safe while you're on it? And if any point you have a question where you're like, I think this is not right for me, understand that's not just your brain, that's your entire being, your entire body is orchestrating this one message to you. And I want you to have the wisdom to listen, because the worst thing is when you're like, I don't think this is working for me. And then, for example, with like mood issues, and then next thing you know, you're on a new mood altering medication. You don't feel like yourself anymore. And you've forgotten that, oh, once I popped that pill, I started feeling this way, because you become so far removed from it. And your doctor will say to you things like, well, you already started that pill. This is a year later. It can't be connected. And that's simply because you're seeing the wrong doctor. They don't understand how to do a timeline and actually go through the onion layers, as we talk about it in naturopathic medicine, of like the layers of going down deep and understanding, well, what's at the core and how did this actually evolve? Because what's presenting on the surface is not where it started.
One of the most important questions that I ask during my intake is, when was the last time you felt awesome? When was the last time you felt like yourself? And it really puts into perspective, because I've had people pause and say, 15 years ago? And like, imagine going 15 years without feeling normal. And it could be so many things, like right now we're talking specifically about female hormones, which leads to a great question. What is a good female hormone lab? Like, what are you wanting your doctor to request or prescribe for you?
Yeah, so I go through all of this in Beyond the Pill for women who are listening, and we get really nuanced with it. And right now, if you grab the book, you can go to beyondthepillbook.com. And there's actually a lab guide that you get as an extra bonus, so that you can understand all that. And I worked with the lab as well to be able to get lab testing, so that if your doctor won't order it, you can circumvent that. It's not because I think you should replace your doctor. It's because this is your data. And I strongly believe you have a right to that. And I strongly disagree with states who are like, yeah, no, you can't self-order labs. I'm like, you have no business in that. Okay. That's her body. Go away now. So with that, everybody needs a thyroid panel. So every single year, minimum in my patients, it's a full thyroid panel, which is a TSH, free T4, free T3, reverse T3, TPO, and thyroglobulin antibodies. And, it depends on what's going on. We don't always run the reverse T3. It is one of my first baseline, along with total T4 and total T3, because especially with my population having been on hormonal birth control alters genetic expression of proteins that grab onto hormones. And so for some women, their thyroid's just fine. Their total hormones are awesome, but their free hormones are really low. And that tells me they're all bound up. And that actually comes to like liver, gut health. Like, we have to work on these other things. Whereas other doctors will be like, here's a medication. And then that patient's like, yeah. And then I asked that same question, like, when's the last time you felt like yourself? And then anybody who's been on a thyroid medication and they start it and they're coming to me, I'm like, and how'd you feel 2 weeks later after you started it? I crashed. I'm like, yeah, that's because that's not what was going on. So we want to check that full panel. And ladies, your antibodies should be tested once a year. There's this idea in medicine where they're like, we test antibodies when you have symptoms. That's too late. Or, oh, we tested your antibodies now and they were negative, so there's no reason to test them again. Oh, that's funny, because that's how autoimmune disease works. It doesn't just like turn on at some point, like on its own, like triggering events. There's all of that.
My favorite with the antibodies is that, oh, the reference range says that it's 39 to 40, and above, and you're 37, so you're
I
negative.
know.
So we just wait until it hits 39, and then we can do something about it. No, it's a gradient, and if there is an autoimmune attack, there is an autoimmune attack already, so we should do something about it.
Yeah, well, and it's like someone with like Hashimoto's, that's what we'd be talking about with like TPO antibodies. Like you could just be like, "Hi, I'm gonna have you eat gluten all day for 3 days," and then those antibodies would be up, and then they would feel awful for like 6 months. So why do that? Then I'm totally with you on that. There's a different way to look at labs. I think we are much better trained at doing because it's like the true preventative medicine. Yeah, for example. Something like Addison's disease, 21 hydroxylase antibodies will come up positive 10 years later. That's when you expect the disease onset is within 10 years. But most doctors aren't going to test until you're like flatline fatigue, you're getting hyperpigmentation, you've got like, cardiovascular changes, like you've got these symptoms. That's too late in an autoimmune disease. Like we want to intervene sooner. So definitely thyroid panel. Definitely want to be looking at brain hormones. So FSH and LH, follicle stimulating hormone, luteinizing hormone. That's typically day 3 of the menstrual cycle. So the third day that you're having your period. That's how the brain signals to the ovaries. And then we like to do estradiol testing at that time to see how that communication is going. I always, if you're going to run brain hormones, you should also see how the gland is responding, because that goes back to thyroid where they're like, let's just test TSH. Well, who cares? Like, how is the gland responding? Because the brain could be screaming and the gland is responding, but something else is going on. So this is for a menstruating female. And then, day 21, which is roughly, 5 to 7 days after ovulation or 5 to 7 days before you expect your period. And with PCOS women, it gets a lot more nuanced. You've got to work with a doc on this. That's when we like to run estradiol, progesterone. And I usually actually do a Dutch panel at that time. That's my favorite, is the Dutch Complete, because it not only tells me what the hormones look like, but what you're doing with them. So are you making potent androgens so we can get your testosterone, then understand DHT? Are you, metabolizing your estrogen appropriately? Like, is your melatonin adequate? And how does that relate to what's going on with your cortisol? And the brilliant thing about that, as you can see, cortisol versus cortisone. And I'm sure you've seen this. I've seen this so many times where people's cortisol is really low, but their cortisone's through the roof. And then practitioners are like, maybe you should use hydrocortisone, or maybe you should use glandulars. And it's like, or maybe you should chill out because your body they're making plenty, but it's deactivating it because it doesn't want you to die. Like that's aging you at the cellular level. So it's always, I think it's that very different paradigm of coming from it, from the perspective of, why would your body do that? Because your body would never do anything to harm you. It's doing it to protect you. What protective mechanisms at play, and what is it trying to protect you from? The other thing is DHEA sulfate. That's the other thing that you can get in a Dutch test. You can run all of these via blood as well. I just think the Dutch panel is it's a lot more robust, and it's forgiving because if you miss one, you can catch it the next day. It's urine, so it's non-invasive. It hangs out with you. You can do. Actually, I've had patients that have been like traveling. They're like, I was in an airport bathroom, I peed on the thing, and like I just like left it in my bag a certain way. I'm like, wow, okay, you are committed. I love it. Because you've got to catch it in that very, very particular window. The other thing is sex hormone binding globulin. So we want to be looking at that because if you're, and if you do get testosterone testing via blood, as women, you need total and free testosterone. A lot of doctors will only check total, and that's hilarious because you want to see what's actually free and what you're utilizing and understand reference ranges. Those are actually most of the time male reference ranges. So it can be very, very different for you.
Even from nationwide lab to nationwide lab, the reference ranges are completely different. I know that for sure. Quest Diagnostics is less than 82, is normal, and for LabCorp is less than 45. So even within labs, they don't agree.
Well, and they're taking it based on a population that's coming in. That's why our thyroid labs, the reference ranges have been so skewed. They've been based on sick populations, elderly populations. It doesn't relate to a healthy individual in her 20s, 30s, 40s. The other lab I would recommend is definitely getting vitamin D. And that's one of those ones as well that, like, if you're in the Pacific Northwest and it's based on, what is the average in that population, it's going to be like, oh, if you're at 20, you're doing awesome, because you're not getting as much sunlight exposure. And in reality, you really need to be above 50. Like, that's more of the ideal.
It's like the RDA for like vitamin C, Oh, you need, X amount of milligrams or grams a day, to prevent scurvy. Yeah, but vitamin C is not a scurvy dependent micronutrient. It has so many different functions in the body to make collagen, antioxidant, blah, blah, blah. Sure, if you keep this threshold, you're not going to develop scurvy, but you need a little bit more in order to be a normal functioning human being.
I get that all the time. People will ask about my supplements and they'll say, "Well, I don't understand. Why is this so much higher than the RDA?" And I'm like, "The RDA is just recommending the basic minimum so you're not sick with like something like scurvy or rickets." Like,
Yeah.
and that's like, we're not pirates, okay? We're not pirates. Like, we're not worried about scurvy with that. But yeah, it's I love that you bring up vitamin C. I'm a big fan of Linus Pauling's work. Of course, if you come from a nutrition background, you best know Linus Pauling. And he was saying so long ago, he was talking about the doses of vitamin C that we need. And I recommend a lot more vitamin C with my patients, just because it's something. So ladies listening, vitamin C helps with adrenal function. It'll help you create your progesterone following ovulation. And if you're wanting to get pregnant, it helps with the endometrial lining so that you are more fertile. And even if you don't want to get pregnant, you still want to be more fertile. Like, you want to be fertile. I don't know that I would say there's more fertile. There's like fertile and not fertile, but like in terms of like, there's a lot of nuances to that. But with that, it's like some studies have shown as little as 100 milligrams can help. But honestly, it usually takes a lot more than that. And then you also have to factor in that, like, if somebody's a smoker, they need a lot more. Why? Because of oxidative stress. So where are they living? What is their occupation? What are they getting exposed to? Like, that's the thing where I feel like the RDA and a lot of these powers that be haven't caught up with the fact that the environment is becoming rapidly toxic. Like, it's so out of control right now. And I say this because I have a 6-year-old and I go to bed some nights freaking out, being like, what are we doing to the world? Because a sick planet is a sick human population. Like, we're not mutually exclusive.
How old is your car? Are you driving an hour in heavy traffic? And do you have like a HEPA filter inside your vehicle? So like all of these things, that affect your lungs, like smoke, are being completely dismissed. And yeah, we live in a very dirty environment. The most important thing, and I cannot emphasize this enough. If you have any of these questions about your birth control history, or you want to, prevent a pregnancy and you're not sure how to go, around this, get the book. It's going to be going into Dr. Brighten's mind and just spending, a couple of days in there, and it's going to be amazing. But just as a teaser, okay, we're going to do a lightning round, and we're going to ask Dr. Brighten to kind of like explain it like I'm 5, and we're going to go through all of these different tests that she asked, and she's going to give us a quick summary of what these hormones are doing, like a Sparks notes, of what they do. Okay, so testosterone, it's just for guys. What is the, that's what I hear, like, why are you testing my testosterone? I'm not a guy. So what does testosterone do in a female's body? And to me, that's probably one of the things that gets missed in females the most. And it's, when you find a true testosterone deficiency or whatever, that can be life-changing. So testosterone, why do we test testosterone? What does it do in the body?
Yeah. So, and you will get into chapter 2, called The Lowdown on Your Hormones in Beyond the Pill. So this is the chapter that every single woman should read. You absolutely need to read this chapter. So we talk about all the hormones, how you make them, what they do, what does it look like when they're low. So low testosterone, we're going to start to see muscle atrophy. loss of libido. I mean, that's the thing everybody always thinks of, but then you're also going to see degradation of your heart, your bone, your brain. You lose your mojo for life. And what that means is that you'll find you have lack of motivation, you're fatigued throughout the whole day, and you just lose that like kick-ass edge that you've always had. And so testosterone is a very, very important hormone in women's health. And it's something that gets gobbled up by hormonal birth control, but it's also something, it's getting knocked around by all of these endocrine disruptors. So, ladies, testosterone, absolutely essential. And when you get into chapter 10 of my book, you're going to read all about orgasms and why those are so important in women's health.
Okay, now let's talk about estrogen. And within estrogen, there's three fractions. The difference between estrone, estradiol, and estriol.
Yeah, so we can basically say it as E1, E2, E3. So we've got estrogen, and they're not all created equal, which is why I said, I'm talking about a menstruating female, we want to test estradiol. Estradiol is the main estrogen when you are a menstruating female. Once you transition into menopause, that's where estrone, that E1, comes on. And then estriol, which is E3, is the main estrogen that we see in pregnancy. And you still have it. You still have ratios of all of these throughout your life cycle. It's just like, who is the dominant diva of estrogen in terms of where you're at. And that estriol is something that if you are a postmenopausal woman, you may have been prescribed it because it does help topically with things like vaginal atrophy, pain with intercourse. And so doctors will prescribe it. I prefer DHEA because that affects the pelvic floor muscles. Plus it's good for your orgasms. And if your male partner gets exposed to it, it's not like giving them estrogen. But that estriol is a weak estrogen, which is very beneficial, which is why it's hypothesized that, being pregnant helps with things like breast cancer and these other, estrogen related issues, is because that you'll have bathed in estriol for about, just shy of a year.
And you said something about DHEA that, and how using, the precursor hormone can be very useful. I don't know how you feel about this, and maybe I'll learn something. I think that in old school functional medicine, if you were deficient in like hormones, they would like say, oh, you need pregnenolone. And with the idea of going higher in the pathway and then letting your body decide. The problem is that if you're broken or if you're not processing pregnenolone the right way, you are just putting more fuel into the fire because your body is not going to maybe make the testosterone that you need, maybe make the estradiol, and maybe you're going into the cortisol pathway, or maybe you're making more estrone. Do you agree with that? Or because pregnenolone you can pretty much get over the counter, and it can be a little bit dangerous to do that.
Yeah, no, isn't that crazy? Like the things that you can get over the counter and the things you can't. It's like it's still, I'm like still to this day, for anybody listening, go down the rabbit hole of acetaminophen research and you'll be like, how in the heck did that ever get approved? That is like some gnarly stuff. So so the way I describe pregnenolone in chapter 2 of my book is that she's the mama hormone. She's going to give birth to all these other steroid hormones, but it can get squirrely, right? You give pregnenolone, how can you control the pathway? You better be a badass biochemist who's like, basically living with your patient. Some people can do really well with pregnenolone, but, I've seen, so for example, I do have some male patients, and they like being on pregnenolone, coming in, complaining they're crying all the time, they're starting to like lose muscle mass, and their breasts, they're like starting to get breasts. And I'm like, well, that's going into estrogen. Like, you've got a problem here. Stop that. So with pregnenolone, that can be a tricky one because it can be squirrely. And you're absolutely right. If you're already kind of like broken in terms of like the systems, how they're flowing, not that you as a human are broken, but like the pathways are broken, that could just lend itself to further imbalance, especially if you have a state of estrogen dominance. Like, why are you going into estrogen dominance? That's the question before you give pregnenolone. Now with DHEA, what we use topically is a very, very low dose. So it's only about 10 to 13 milligrams that you would use topically. And typically, we do that nightly for like 3 months, and then we taper it down to where it's like a couple times or 3 times a week. And with DHEA, it can go into estrogen or testosterone. So if you are somebody who has excess androgens, that probably wouldn't be the best bet for you. However, if you are a postmenopausal woman, odds are that you're struggling with testosterone. And that's why we always get baseline lab testing before we go there. But in terms of the research, estriol is really good at plumping up the mucosal tissue. So that basically means that the vaginal cells get plumped up. There's more lubrication. Yay, we don't have vaginal dryness. This isn't just about sex. I mean, women can have pain, friable tissue. They go to the restroom, they wipe with toilet paper, they're bleeding. Like that's how bad things can get with vaginal dryness. But with that, DHEA actually helps penetrate the muscle floor. So it helps with the pelvic floor muscles. And if your pelvic floor muscles are toned, doing their job, not overly taut, you're going to get better blood flow and circulation. Overall, the health of your pelvis is going to be a lot better, and you're less apt to be developing things like urinary incontinence or repeat urinary tract infections due to the lack of integrity in the pelvic floor. And then, like I said, because the dose is so low, if you are using that and then a woman, like her partner gets exposed to a male partner, it's not something like them getting exposed to estrogen. Okay, this is DHEA. Their body should take it and put it into the testosterone pathway. I'm not advocating that you go and do that, but it is something that it's like less of a risk. And honestly, I mean, I've had so many patients tell me that they place DHEA, 20 minutes later, they're having the best sex of their life. So there is that, that little piece of, that's my clinical pearl for the day for this podcast, having awesome orgasms. But the other thing that I would say is like making sure, get the lab testing before you jump on, because there is DHEA, and there's research to actually show, like, for instance, with like Hashimoto's, taking oral DHEA can actually lower antibodies. But the thing is like, why are you not making your DHEA? That's an adrenal hormone. If you're not making it, there's probably something else going on. You can't just out medicate or supplement like poor lifestyle choices and expect that that's going to really turn everything around. It's just, I wish I had different news for you guys, but it's just not how that works. And I'd also say with oral, you have to take higher doses of oral. So that's not my first go-to with DHEA.
And just to bring it all around, it could just be that you don't have enough vitamin C. Like, how crazy is that,
Or B5 or magnesium.
Yeah, it could be or maybe don't be a dummy and go to sleep at a decent hour, Okay, progesterone. That's probably one of my favorite female hormones.
Really? Because like you have a girlfriend, and estrogen's what plumps us up, and as you'll read in my book, it's that va boom, estrogen boom. So
well,
I
say that because a lot of my female patients that have insomnia, you just give them a little bit of progesterone, and you can like change their lives. But you're right, estrogen is the sexy hormone.
Yeah, I mean, that's why we got all of our curves.
Yeah.
But with progesterone, the cool thing about progesterone, and the cool thing about all of our hormones is it's not just about reproductive health. And so progesterone comes on, you ovulate, corpus luteum is formed, that's a structure inside the ovary. That secretes progesterone. Progesterone is going to help you feel chilled out and calm. If you are frazzled, you are anxious, you are not sleeping, your breasts are tender, you're crying all the time before your period, you don't have enough progesterone going on. And so, with that in mind, progesterone is not just helping protect our breast or helping with that endometrial lining. It's also stimulating GABA receptors in our brain. And it has an antidiuretic effect as well, unlike the progestin in hormonal birth control that does not have that same effect. And the really cool thing about progesterone, estrogen is absolutely essential for neurological health, but progesterone is actually very protective in terms of like, if you are getting hot and bothered with inflammation in the brain, progesterone can be beneficial with that as well. And so I think this is a really, I try to do a service to our hormones in my book, Beyond the Pill, because it's not just, doctors are always like, your hormones are about reproductive health and only your reproductive health. And it's like, no, it's not that myopic. It's a concert. It's a symphony that's being played in your body and everything. I like to joke, who doesn't care about the compartmentalization of the systems in your body? Your body. Your body doesn't care how medicine wants to split it up. Like, it's all interrelated.
Yeah, no, it's insane to think that way. It's like a doctor is not going to be worried about your female hormones up until you are trying to get pregnant, you don't get pregnant. And that's the extent of it, because
oh my God, so right.
Because after that,
I'm rolling my eyes, you guys.
Because after that, the lab ranges for someone that's postmenopausal is basically, if you have non-existent hormones, that falls within the lab ranges. So you can have zero estradiol, zero testosterone, very little or no progesterone, and a doctor that is not savvy with functional medicine can look at those labs and be like, well, you're peri or you're menopausal, so this is completely normal, and that's outrageous.
No, 100% to that. It's there's just so many disservices done in women's medicine, but also this idea that like, so many doctors will throw up their hands and be like, well, being a woman's just difficult. And of course, like hormones are awful and they're betraying you. So you just need to come in and you need to shut that whole system down. And in reality, hormones are designed, they give women superpowers, like major, major superpowers. And when they are working optimally, like that's the thing is that I'm like, if every woman had their hormones in balance, oh, watch out, world, watch out.
Yeah. And it's not that difficult. The first thing you got to do is go back to basics, eat right, sleep right, hydrate, take care of your liver. And then the second thing if that doesn't fix it, the second thing you need to do is buy the book. Go and buy Dr. Brighten's book, read it, and I believe, that around 80 to 90% of the population that reads that book is going to benefit, and they might not need a practitioner. But that 10% that needs a practitioner, how can they find a doctor that can help them, that's not going to roll their eyes when they say, well, I actually read this book, or I actually want to get this labs done? Because you and me, it's two people, and we have a definite amount of hours that we can spend clinically. What is your best recommendation for people to look and seek for a healer?
Yeah, well, you're going to find all of that in the back of my book, where I actually I list places to go look. And then I'm very specific to say, like, you want to make sure that you're working with a licensed practitioner who has the right to prescribe if they're making recommendations on hormones. And, it's not that I think, everybody has a seat at the table when it comes to healthcare, but because these hormones are over the counter, some of them that we've talked about, I have seen patients where, their nutritionist is recommending progesterone for them for their irregular periods. I actually had this happen with a patient where their nutritionist was having them use progesterone cream. They were having abnormal uterine bleeding. So it's like in medicine, that's a red flag. Like that's a scary thing. And when she came to me, and the nutritionist like actually wrote me and was like, I'm going to keep managing the progesterone. And I was like, honey, you can't actually manage like, don't put that in writing. Like, that's not good. And when the patient came to me and gave me the history, I was like, we actually need to send you to the gynecologist. We need to get a biopsy. And sure enough, she had endometrial cancer.
Jeez.
And I'm like, you were covering that up with these hormones, which were helping for a period of time for you to have a regular period. But like, it's very important because, it's not always a big scary thing. And I don't want anyone to feel afraid. That's why I wrote this book, to give you all the explanations. But it is something that if you really want to fix your hormones, you're going to have to work with a licensed clinician who is trained in lab interpretation, who has a license to order labs, to prescribe medications if you do need to go there. Because the people who have a license to prescribe medications, those are the people who are trained in pharmacology to understand it. And we have a certain number of hours we have to do. I have an Oregon and California license. So that's always like really fun to be like, yay, take all my money. We have to renew the license, but that, and then I have 2 DEA license on top of that. I'm like, and so, that's just something that I really caution people about. That doesn't mean nutritionists are bad. In fact, I used to be one and I highly recommend them and I employ them. Same with health coaches, same with, having chiropractors as part of this, having a gynecologist so you can make sure that you can get a check. Like everybody really has a seat at the table. And like you were saying, in Beyond the Pill, I take women through like, there's a quiz on figuring out your hormone imbalance. And then immediately I'm like, go to these pages. This is where the solution is. If your hormones are imbalanced, you ain't got time to read a whole book. Here's where you go. Go right there. Start doing these things. There's a meal plan. There's recipes. They're awesome and delicious. There's so much lifestyle, mind-body medicine within the book. And then I take you through a gut quiz. Do you need to fix your gut? How do you do that? Liver detox. What does that look like to need to do a liver detox? And how can you actually eat in a way to support that? There's an entire chapter on thyroid and adrenal health, an entire chapter on reversing metabolic mayhem, which is really at the root of what gets so many of our hormonal issues just spiraling. So talking about that chapter talks about insulin dysregulation, blood sugar, but it also goes into cancer risks and what women should be in the know on if they do choose hormonal birth control. And then we've got a whole chapter on mood swings, anxiety, depression, all of these mood symptoms, how they're related to your hormones, because yes, so many doctors will tell you that they're not, and yet they are. And then boosting your libido and fertility is another chapter to really help women who are in need of all of that. And with all of those chapters, I talk about what lab testing you should be getting done, what your doctor should be investigating. There's actually chapter 4 is Take Back Your Period. That is all about, this is your period problem. This is what might be the cause. This is what you need to do right now. And this is what you need to talk to your doctor about. And with that, you can actually take the book in. There are so many citations in the back, and you can actually take it into your doctor's office. And I always recommend that women approach it not from a place there, something happened, I think like 5-10 years ago, like this story started spiraling where it was like, your doctor works for you. You tell them what to do. That will not work. Okay. No human likes to be told what to do. They have a visceral reaction to it. Okay. Their hormones will actually spike, not the good ones. So instead, you want to go in and you want to partner with your doctor. And I like to say this, that this is my analogy. If you go to the sandwich shop and you ask for ice cream, y'all are going to get really frustrated quick because they don't make ice cream and you really want ice cream. That's the wrong place. You need to go to the ice cream shop. So sometimes you're going to like your GP, your PCP, and you're like, I want this thing. I want functional medicine. You're in the sandwich shop asking for ice cream. They're not a bad doctor. It's not that they don't want to help you. It's just that like they're really good at making sure you're not going to die like right then. Like that's like, let's all take a moment to respect like how necessary that is. Thank goodness for these wonderful doctors. But if you want root cause medicine, that's something I recommend heading over to the American Association of Naturopathic Physicians. They only list licensed, truly trained naturopathic physicians. And I say that because there's this thing that happens in medicine where people say they're doctors when they're not. I've actually met, people who they're like practicing medicine. And then, I find out years later that they have their doctorate in philosophy and they were like calling themselves a doctor. And I was like, whoa, you had me fooled. That's totally. And so the consumer has to be savvy about this because these regulating bodies exist to protect you, but there's only so much, that they can be doing every day. And so something like the AANP, which is the American Association of Naturopathic Physicians, is a really great resource and then you always check with your naturopathic physician, what college did they graduate from? Do we have 7 accredited colleges in the United States?
In the United States, it's 5. So you have NUNM in Portland, Bastyr in California, and Seattle. My alma mater, the Southwest College of Naturopathic Medicine, National University in Chicago, and Bridgeport in Connecticut.
On the East Coast.
On the East Coast, yeah. And then you have a school in Toronto, I want to say, and then one in BC.
Yeah, that's as I understand it. And so check that your doctor graduated from there. I mean, that's something that's really, really easy to do. I always crack up when people they write my team and they're like, I can't figure out like what kind of doctor Dr. Brighten is. I'm like, I have a whole about page and like you can Google this, but it always cracks me up that people will be like, oh, I didn't think to check her about page, or I didn't like look. And I'm listed. I am part of the Institute of Functional Medicine, so I'm also listed there as well. And that's another great place that you can find licensed practitioners doing functional medicine. And you just want to make sure that they are trained in this, because some of them will have taken a class, but they're not really practicing it at this time, because what they're doing is they're building up their skill set, their knowledge base. But, for instance, sometimes someone's still working in emergency room, emergency medicine, then you're trying to contact them and you're like, wait a minute, you're listed here. And it's like, well, they're making their transition. That's what that looks like. But I think that's another great resource as well. Just understand that on there, they list multiple licensed healthcare practitioners. So you might, you want to look if they're like a registered dietitian or, nurse practitioner, physician's assistant. There's, and just depending on like, and the other thing is like, who do you jive with? Like, and what are your needs right now?
You can schedule an appointment with me, and you just don't jive with me, and
Mhm.
that's going to hinder your progress. So make sure you like your practitioner. I love your analogy of going to the sandwich shop and wanting, ice cream, or going to a fast food restaurant and wanting, a 5-star meal. If you want 5-star treatments, and it's not a problem of the practitioner not wanting to give you a 5-star treatment. Sometimes insurance companies don't allow the practitioner to give you that 5-star treatment.
Oh, it's so true. Or they're part of a practice management group that will actually dock the doctor's pay. So the doctor will get a fine because they ordered a lab that somebody else in administration, not with an actual medical degree, deemed unnecessary for you. It's stuff like that where I'm glad that you're bringing that up because I think it's real. I mean, it's really easy to like want to hate on the doctor because they're sitting right in front of you.
Yeah.
But like, please, for a minute, just recognize that nobody gives up a decade plus of their life unless they really, really want to serve and help people. And that's what your doctor did to be able to help you.
So the best way to get top-notch service is to pay cash. It go to a cash
This
base.
is so true, right?
Isn't it? Because like as a, in a cash based practice, now the incentive is not to fill out this rubric that the insurance company has pre-designed for you, but it's to get the patient as better as fast as possible, and that's going to get you the best care in the world, and in the end is going to be cheaper because it's going to be faster. It's going to get you better faster. You're going to be utilizing your resources in a real economy, not a fake economy that, of insurance company. But we are not used to paying out of pocket for healthcare. So that could be a shock. But trust me, if you want the best care, you need to have some skin in the game, and going to a physician that is going to be on a cash based model where you know what you're paying for. I think that's going to be important if you want this special treatment.
Yeah, and I've actually seen that where when people pay out of pocket, and there might be people listening right now being like, I could never afford that. Like you'd be surprised. Like we talked before we started this interview about how my son is really sick. I ended up having, we had to stay in France and I had to pay out of pocket for things. And people were like, wow, like, some people were really mean to me. Most people have been supportive, but some people were like, oh, wow, must be nice that like you can afford to do that. And I'm like, we did no Christmas presents. My husband and I did not get Christmas presents this year for ourselves. And our son got like, just a handful of things that were actually all toys selected to help with neurological healing. So they're actually medicine based, not like medicines, but like in terms of like brain activities that help with neurological health. And when I, said that to people, they were like, "Oh wow, like that, like seems like a sacrifice, like a big sacrifice." I'm like, it's really like to have your child back or to have your health back. Like if you've ever been rock bottom when you don't have your health, so before I was diagnosed with Hashimoto's, I missed out on like the first year of my son's life. I couldn't be the mom I wanted to be. Like I can't get that time back. So if you ask me to value that, like I would give up. There's so many things I would give up like in a heartbeat to be able to have that time back. The other thing, to your point on that is that I do see people get better a lot faster because there is no delay waiting for pre-authorizations for like what's the insurance going to pay. No sticker shock. Like how many times, a patient, their insurance company's like, yeah, we will, we cover labs. And then when it's all said and done, here comes this like $10,000 bill for labs and they're fighting with the insurance company for 2 years. And meanwhile, they have to pay the lab company. It's like all this kind of stuff happens, but 100% that when I've noticed when people are paying, fee for service, and not going with insurance, like those are the people that get better so much quicker because they're very dedicated and very committed. And that's not to say you're not dedicated or committed when you use insurance, but when you actually see that money flowing, it's a different psychology. And there's people out there talking about the psychology of insurance and like how people taking a backseat to their health and that can keep us sick. But the other thing is that there's no middleman. It's just you and your doctor's best recommendations for you. And I remember once this insurance company that they sent me a thing and they sent me a letter saying, with this patient, you may not talk about diet. Like, we will cover the services, but you may not talk about diet, right? Okay. So first, I'm a naturopathic doctor, and two, like, I'm me. And so I understood it as I read the letter, and I had to talk to a medical biller. That's the other thing. Your doctor has to pay a medical biller on top of that when they work with insurance. And they were like, that means it can't be in your treatment plan. Okay, fine. So a year goes by. They audit my chart notes. This is something insurance companies do. They're like, oh, we need to make some more money back. They audit my chart notes. And because I asked about diet, because that conversation happened, never mind that everything else happened and diet wasn't like, directly in that treatment plan. They were like, a conversation was had about nutrition. Therefore, you must pay us back everything from that patient in the last year. And I was like, wait, what? Like, I have to like now and it's stuff like that. So this is a bit of a tangent. Everybody listening is probably like, why are they talking about this? Because I think this stuff needs to be talked about, because I think the doctor gets the short end of the stick a lot in healthcare. I mean, a lot of licensed healthcare practitioners, they're the person sitting in front of the patient. But, and these other powers that be are so far removed that, it's the doctor who gets the brunt of it. I say this because I have friends that are licensed healthcare practitioners across the board, and we get together sometimes, and I'm always shocked at like the really mean things that people can say to other people.
And it's not, like, for example, with specialty tests, okay? We don't believe that in order for you to be healed, you have to do every single specialty test under the sunlight. That is not a thing. And if your doctor says, before you come see me, you're going to have to spend $5,000 in testing, run away. That's go the other way. Okay. But second, I was running a stool analysis on one of my patients, and they wanted to get it covered with the insurance, and they had a good, a good doctor that would run it for them. I started clicking all of the things, on your conventional lab, that would be covered in a specialty test. That test came out to be upwards of like $1,700. The frustrating thing is this, that my patient might pay a $30 copay or something like that, okay? So they pay that $30 copay, and they're like, you see, we save money. No, we didn't. Someone has to pay for that. Maybe in an inflated, cost at the emergency department. Maybe at, by charging $900 for a $200 MRI. Maybe by doing, someone will pay for that. Someone's getting screwed. That is not good karma. And then whenever you do a specialty test, like, for example, a Dutch, or when you do a microstool analysis, because it's a cash-based system, so it's $500 or whatever, but that's the cost. No one's bearing any more burden of that. You get your results. You don't have to go through hoops, and it's just a cleaner delivery system. We need to pay for things that are worth a certain value. We need to stop trying to, bullshit the system, or try to, skeeve ourselves into how to get the services. We need to be responsible for our own health.
Yeah, there's really, I think back to like, just, there's no such thing as a deal. Like, you get what you pay for. And how many times I've had to learn that the hard way.
just think about,
just laughing.
Think about all of the different, markers on a Dutch test. How much would that be if you were to go to, your company, your lab company, and get those individually? Just think about it. And that's besides the point, because we have to interpret those things, and that's time outside of your visit. And we can probably do a whole show on this topic, but it's been an hour. I want to be very respectful of your time. Always an amazing interview. But Dr. Brighten, how can people pre-order the book? When is the book out? What can we do to support you? Because we need to get this message out.
Well, I appreciate that. You can find the book Beyond the Pill really anywhere books are sold, but certainly Amazon. You will want to grab it because January 29th it will ship out, and the word is on the street that Amazon sometimes runs out. But if you pre-order, then you actually like you're guaranteed a book. So yay Amazon for that. That's a really good problem to have as an author, by the way. I'm not upset about. Well, I am upset people can't get the book if they want it right away. So, and when you order it, you can go to beyondthepillbook.com. We've got over $250 of bonuses there for you. That was my way of saying thank you to everyone for their support, and that also includes like the lab guide we talked about. It includes recipes. And then there are 5 exclusive interviews with people who brought some expertise in and went a little bit deeper in topics that I had to cut out of the book because you had to be able to hold it in your hand. It is a big book, so be ready for it, you guys. So thank you so much. And then, of course, if you want to come hang out with me, Instagram at Dr. Jolene Brighten, my main hub, drbrighten.com. And then you can check out my YouTube where I have videos because I know everybody learns differently. So however you want to come hang out with me, I invite you.
Awesome. Thank you so much. I can see, I know it's not for pleasure, but your beautiful window, and the Eiffel Tower was, going all different colors a second ago. So that was pretty cool. That was oh shit, we've been here for over an hour now. So thank you so much for being here. I can't wait to do like a Facebook Live with you one of these days, maybe after the book and after all this craziness goes by, just to continue answering questions and serving our people, because that's what we're here for.
Awesome. Thank you so much for having me. Always a pleasure to chat.
No problem. And if you're ever in Arizona, hit me up, okay? And if I go to Portland,
sure.
I will do the same.
Oh, yeah. We'll eat some more Mexican food.
Oh, more paleo Mexican food.
Yeah, right?
Awesome. Talk to you soon.